Okay, thanks for that kind introduction. Really fortunate to have a distinguished panel here today to talk about some groundbreaking stuff going on in the digital health frontier. So allow me to frame up the panel for a second. About 85% of healthcare costs today are related to chronic diseases and their management. And so our genes certainly play a part of that, but the majority of the issue revolves around personal choices regarding nutrition, smoking, stress, sleep, exercise. So as such, a lot of these diseases are preventable, and they are all treatable with a better managed lifestyle and lifestyle choices. However, most of our healthcare systems really only, they don't focus on prevention. They only kick in when there's a need for treatment. So we're changing that. Thanks to the creative ecosystem partnership we're going to hear about, new digital technologies enable us to cost-effectively identify individuals with risk factors and then get out in front of those risk factors earlier to treat the patients. So as a result, we now have the capability to deliver more personalized health care to a wider population at an earlier stage and generally at a lower cost. But that's not really the big news here. The big news is the payers are starting to pay for the economic and social benefits that digital health brings to their members. So the health and wellness spectrum, the continuum between kind of basic nutrition and fitness on one end, and then full-on disease management integrated on the other end, is just too large and too complex for any one company to manage. So that is the genesis of the ecosystem approach to personalized healthcare and population health management. It really does take an ecosystem. So forward-thinking purchasers, like we have on our panel today, they recognize the value of digital health to their members. They have a business case, they have a trusted brand, and they have access to a large pool of customers. They just need a design and delivery system flexible enough to meet these complex needs. On the other hand, digital health providers, like we have on our panel, they have the ability to deliver relevant content in a scalable and cost-effective way across multiple platforms and geographies. They just need customers. So let's hear from the panel today about how they are building a functioning and digital ecosystem, again, with paying customers, and learn from them the challenges and opportunities this presents. So to get started, I would like to just go down the row here and ask each of our panelists to introduce themselves and talk a little bit about their company and its role in the ecosystem. Stefan, do you want to start?
Yes, thank you, Todd. Well, a pension insurer has just two businesses, if you like, to handle the old age cover and keep people out of disability, prevent it. We do that for roughly 200,000 people in their active work life for the moment. And of course our focus is on the whole work life of a person. That's roughly 40 years. Traditionally, the services of pension insurers has been directed to big organizations and organized HR departments, but the future of work isn't in that direction. It's more based on what the individuals do, often so that the business and the individual actually is the same person. Now we do three things. We try to support the business in day-to-day management. That means supporting in leadership skills, in handling team issues and things like that. Then we are strong believers in measuring and working out of data to catch things early on and do early interventions. And the third, of course, is that if then the individual has crash landed, so to speak, and needs to restart the career, we offer services there too. All in all, I think this digital thing now gets us closer to the individual, and we need to be there. It's now with feasible cost, and I agree with Todd, we have to do it as an ecosystem. No one has to kind of whole solution, we need a lot of players. We seem to have some issues with the slides. Oh, okay.
Okay, I come from insurance company called Lähitapiola, and we have this new strategy for lifelong security. And what it means, I think it means that our goal is changing from the party that covers sicknesses and accidents and things like that. We want to change that goal and prevent those bad things, and it means that we want to be involved in our customers' lives every day, in bad and good days, both. And that's why we have, I work in a unit which develops healthcare and well-being services, and I work there as a development manager, and of course the focus is in digital services. And we can't build them alone, we need partners. We have a quite big partners, a lot of those, but now we are building a platform, and we are doing some co-work with many partners that we can have together on that platform.
Oh, okay, it's me. Okay, good morning, everybody. My name is Miikka Kiiski, and I come from IBM, where I work in the development of our healthcare ecosystem here in Finland. So the IBM approach to healthcare is obviously very data-driven. So what it is all about is being able to gather data from multiple different sources, different types of data, combine that data into some meaningful information and insight, whether that's about a population or a specific target group or even on an individual level. Meaning that you could get a sort of a 360-degree view of an individual on one hand side. On the other hand side, you will be able to figure out what are the, let's say, most critical groups in a population where you should target your resources and focus your effort in able to intervene in early enough. As for the ecosystem, I suppose one of the reasons why I'm sitting here today is that we are working in an ecosystem with some of the other members of this panel on a very interesting pilot project right now, which relates to well-being and personal health. So I'm really happy to be part of this panel with my friends here this morning. Thank you.
So good morning, my name is Tomi, Laitinen, and I'm partner in a company called Negen. So our company's DNA is actually genetic testing and analyzing, and also communicating this genetic information back to the people. Current focus is on the highly important diseases, national diseases, coronary heart disease and type 2 diabetes. But also we will have a pharmacogenetic test panel in our service. So in a nutshell, what we do, we actually combine the lifestyle and environmental factors and your genetic background into the health assessment, that you can see the holistic view of your health risk. And then it's totally different when you can actually when you can use. A couple of years ago, we had gene markers for type 2 diabetes around 50. And for coronary heart disease, gene markers around 60. Currently, we have in our test panel 5,000 for type 2 diabetes and 49,000 for coronary heart disease. So the accuracy is already better. And what this means is actually that you can see that even though your lifestyle and environmental factors are kind of at the decent level, when you add this genetic risk score into this assessment, you can see that, okay, with Miikka, he has a low risk to, for example, coronary heart disease, but for me, I have a high risk. So for me, it means that I need to search the help from this type of ecosystem that who can help me to succeed in those lifestyle changes. Because when you can succeed in those, you can actually drop your risk from high at the same level than the low genetic risk population. So that is what we have available for you.
Thanks. So good morning, everybody. My name is Michael Quashy. I'm one of the founders and CEO of Wellness Foundry. Our main product is Meal Logger. And so what we do is we provide a digital nutrition coaching platform where clients photograph their meals and they get feedback from a professional, and they can also share that in the group. That's what the end user sees. They then get feedback from the professional, guidance on how to improve their diet. And this basically scales the delivery of these services, which are crucial for behavior change. Now, from a professional's point of view, we provide a little bit more because now they get a scalable platform. They can handle 10 times more clients. And from an institutional perspective, we actually gather a lot of data on the back end. So we look at all the social interactions. We get to see who's connected to who's at risk of falling off. So clients, for example, like Attendo, Optum, and others have a way of managing the risk in their population in a scalable way. So our clients range from insurance carriers to healthcare providers to pro athletes. We had over 50 athletes at Rio. And the reason why we're here on the stage as part of this panel and part of the pilot that Miikka mentioned is because given the complexity of nutrition, if you consider, for example, your genomic background, your gut microbiome, your activities, your stress, sleep, lack of sleep, those all impact your daily behaviors. And so if you don't take those into account, it's impossible to provide any kind of meaningful coaching to you. And so an ecosystem approach is really the only sensible one because we can't collect all that information ourselves. And at the same time, we collect information that's highly valuable to a lot of our partners. So that's our contribution to this ecosystem.
Good morning, Jaakko, Olkkonen, CEO of Wellmo. Before Wellmo, I was actually Matti Vänska's predecessor running Nokia's health tech investment in 2008 to 2012. What is Wellmo? Wellmo is probably the only health app which doesn't have any health content or programs. Wellmo lets the insurance company or the service provider use the best services, apps, content from the market, while providing a unified, branded, and differentiated experience to their users. And to the admins at the insurance company or service provider, Wellmo displays the statistics about usage of those various services and the outcomes analytics. So it's really a platform which enables rapid launch of comprehensive services and also rapid iterative development based on real data. Thank you.
Okay, terrific. Thanks, everyone. So you can see the dynamic interplay here between the payers and the providers and then the platform provider. So I'd like to ask the panelists now, what do you see as the current role of prevention? How does the ecosystem promote prevention? And what do you see the role of prevention in the future? And Stefan, if you want to take that first.
Well, I think prevention is the obvious key, but even listening through this, just this panel, I think it illustrates what I think is the main challenge, how we organize ourselves. If you look at from the point of the HR department of a company or why not the individual, this looks like very complicated and scary stuff. So how to provide the entry point in such a manner that this becomes human scale, I think is the most important.
I think that this preventive way is the only way we must do it. And now it's possible because we have so much information and devices and platforms and things like that. But I must say that not only when you are not sick, also we must think about people who are already sick, so we can talk about secondary prevention. So we have a lot of work to do on that thing.
Okay, new technologies just made prevention so cost efficient that it can be provided to everyone, and also so personalized and user friendly that most of the people also can actually use them and get benefits out of them. And we believe that prevention will actually become the center of healthcare, like my colleagues already said here. People will choose their main health care partner based on the preventative services, and then they will trust that partner also as comes to recommending reactive health care when that is needed, if it is needed. And I think that insurance companies are in a great position to actually take this role and play a much bigger role in the future in the healthcare industry.
Yes, and I think prevention, it has to be data and evidence-based. So where you get the data from is what Michael referred to already, that no single party has all the relevant data that is required. So therefore, the ecosystem approach and the ability to sort of include data sources and applications from different players in the ecosystem is so critical. And of course, then the ability to consume that data and make something meaningful out of it and something actionable out of it. So I guess I'm going back to the data-driven approach, but I think that's really what our point of view to this prevention is.
I think that genetic testing is actually really has value and is more accurate to identify those high-risk patients. So then when you can identify those high-risk patients, it means that you can prevent those diseases or at least diagnose earlier. And a couple of years ago, exactly 2 days from now, we had ice hockey tournament in Nokia, and one of our teammates was playing there also. And after Thursday, from 2 days from now, we got the message from our team captain that he had died. 47 years old male without any diagnosis earlier. And after the autopsy, they found out that he had coronary heart disease. So this is something that really motivates to identify those high-risk patients and help them to prevent these and at least to be treated while they need it.
I guess at this point, I agree with everybody. But I think one thing to add is I think one of the things that's going to happen is as focus shifts to prevention, what we're seeing at least with our customers is that it enables the health professionals to do less of the redundant administrative work and spend more time with their patients. And from a preventive perspective, you can't just tell people what to do. You have to somehow motivate them, inspire them, help their self-efficacy increase, etc. And so I think it's also going to change the role of professionals. They're going to become more coach-like, which I think can be a very good thing in many respects.
Okay, great, thanks. So you've heard from all these folks, and as everyone knows, healthcare generates a tremendous amount of data across the spectrum. So I'd like to ask the panel how this exploding amount of data generation is going to change the ecosystem and improve healthcare in the years to come. And let's let Miikka take that one first.
Okay, so yeah, well, I think where data really is helpful is obviously in it enables us to be more accurate in targeting our actions and interventions. So the more data, the better data, the more rich data you have, the more accurate you can really be in pinpointing out where you want to focus your efforts. Then on the other hand side, when you are doing things, when you are intervening, how do you keep track of the measurement of the results? How do you measure what are the outcomes and what are the best actions that you have taken and learn from that? So it's not only about maybe just traditional data science type of application, but also self-learning and many of the cognitive capabilities that are available in today from technology providers like ourselves.
I'll add a perspective to that. These modern watches that Matti Vanska earlier here presented, smartphones, Wi-Fi weight scales, etc., they generate increasing amounts of data, and not only activity, but actually across the board. And there is more and more data available all the time, and it's about getting access to this data. That's what is important, and that can be then used to show these outcomes and so on, and which is the essential fuel for any further development.
Yeah, this is in fact what Miikka said. It's so true. I was wondering that who owns all this data? I think it's a big question. We don't have an answer to that. But it's every day on my life I have to think that can we use this information, what people think if insurance company uses this well-being or health information, even if the customer has given the promise that you can use it. It's still, it's one question. Another is that there is so much data and so much information that how can one, a customer, me, myself, what can I make decisions about that? Somebody should help me. Is it a coach or is it artificial intelligence? And if I am working as a nurse or as a doctor, how can I use that information? It's so much. And how can I know that now the patient here sitting and the situation is some, and then I should know that what are the best treatments for her or for him, because they can be different. So who helps me as a professional?
Yeah, I agree that the key question is whose data. Already within an insurance company there are at least 4 or 5 levels of data available to various professionals, and if you add their occupational health, the employer, public health care, and the list goes on and on, who has access to what data? It's not even clear that the individual has access to his own data. And I think we shouldn't underestimate the legal challenges in this. Nevertheless, I think those can be overcome, but we need to really rethink how we go about this.
Okay, so this is the last question. We're running a little low on time, so let's keep the answers brief, and maybe everybody doesn't want to give one. But all this stuff is great, but if the patient, the individual is not motivated to make these lifestyle changes, no matter how much data, no matter how much prevention capability is available, we're not going to be successful. So how do you on the panel motivate people to make the right changes in their lifestyle to improve their health? And Tomi, do you want to start with this?
At least according to the clinical studies, they have shown that people, when they know the genetic risk data and the kind of holistic view, they are more motivated to start the regular screening, start to take their medication as doctor has prescribed, which has been one of the challenges in Finnish healthcare. And also there have been evidence that people have started to do those hard lifestyle changes. Naturally, there's a little bit dip or drop after 1 year or so, when people kind of feel that now everything has been taken care of, but at least the start is when the people feel the motivation, and that's why we have the ecosystem to help them to keep up this motivation.
Okay, I have a nice episode about this actually in this pilot that we are working on with the guys. Some of the members of the pilot group are my colleagues, and one of them said to me that he's going to get a leave of absence for 6 months so he can only focus on that. So sometimes people are really motivated on these kind of things. But I think it's really about being able to deliver to you such data or outcomes, results, information, whatever it is, in such a form and shape that it makes sense to you, it's meaningful to you, and it relates directly to you as a person rather than just scientific facts or stuff like that. So make it personal.
Yeah, to add on that, I think the data is hugely important to help people understand what's their baseline, how are they progressing, what's happening, and so services that help you understand your background, understand your risk factors, and then brings it together, like Wellmo, for example, that's hugely valuable. And then it helps you understand it, like Watson Health, and that's super important. The one thing that I will add on top of that is that the professional input in understanding that information is also hugely valuable. And so really a lot of times motivation is tied into self-efficacy, and professionals are in a unique position to help people build their self-efficacy and help them with empowerment. In addition to professionals, it's also peer support. So there are a lot of human social factors that relate to this that are hugely important. So as we look at health tech and data, I think it's important to keep in mind that the personal interactions between professionals and their clients and peer support are also hugely valuable.
I think we got time for one more comment before we wrap up.
I have worked as a nurse, and I can tell you that the motivation is a good question, because I think that you can't force anyone to motivate to do anything. It must be something inside you, and the moment when is the right moment to do something. Of course, if you have information about your genes and risk factors, it helps you, but still lifestyle changes are difficult. But when the momentum is, there should be services available for you, and you should have an opportunity to choose the service which is the best for you. Coaching is a very nice thing. You need that one. We can't do big lifestyle changes alone, but I still want everybody to remember that small changes are good enough.
I would kind of agree with everything and just say whatever makes it tick.
Okay, terrific. So to wrap up, I want to thank the panel. They did a terrific job. They're building a real-world ecosystem, and I stress with paying customers. As investors, we like companies that have paying customers, and these guys are figuring out, doing the hard work of putting together an ecosystem that not only generates value, but generates revenue and hopefully profits. So I'm going to go off script for a minute to wrap up. I think it's pretty clear I'm from America, and this is the 25th anniversary of my first visit to Finland. So I've been many times. I probably come as a partner in Courage Ventures. I probably come 4 or 5 times a year to meet with companies. And I know the Finns sometimes don't like to acknowledge this, but you really have one of the best healthcare systems in the world in terms of cost effectiveness and quality outcomes. I know there's a lot of issues, and Finns are never happy. But we in the United States spend 18.5% of our $18 trillion GDP on healthcare. You guys spend 9%. So the challenge for this group, and this is a lot of the leaders in the Finnish health tech industry, is to figure out how you export the good things about the Finnish healthcare system to the rest of the world. Thanks again to the panel. Thank you all for your attention.